We sure do. We've had a good working relationship. Actually, FEMA Region 2 has been very good with us this week, setting up our 2 drive-through testing sites. But there's no question about it. We need a lot more PPE, and we need a big slug of that out of the strategic stockpile.
Okay, we thank you very much for that. Let's turn now to Michigan, where there are at least 790 confirmed cases. Governor Gretchen Whitmer joins me now. Good morning, Governor. You just heard Governor Murphy explain why he issued that stay-at-home order. The governor of Illinois, which isn't far from you, has done the same. Is something similar under consideration for Michigan?
Well, we've been very aggressive. I was one of the first to cancel school. We moved forward with closing restaurants and bars pretty much at the same pace as my fellow governor, Phil Murphy and J.B. Pritzker and Mike DeWine, Republican from Ohio as well. We're continually analyzing and determining what our next move is. And so the fact of the matter is we're going to continue to see these numbers go up exponentially. The problem that we have right now is that we don't have enough test kits. And I heard your conversation with the man from FEMA. We need test kits because these numbers are informative only to a certain extent. We know that COVID-19 has infected a lot more people than just those who are being tested and testing positive. And that's why in order to make decisions, we really need better data. We're all building the airplane as we fly it right now. We're doing the best that we can. We're going to continue to be aggressive, and we're continually monitoring what the next move we can make is. But we need the federal government to get us those test kits. We need PPEs, as Phil was just saying. We need clear directive and guidance from the federal government. And frankly, a patchwork strategy of each state doing what they can is, we're going to do it if we have to, but it would be nice to have a national strategy.
Ma'am, you are the governor. Get on the ball. Quit blaming the federal government and blaming the president. And Martha, just set her up so she can attack the president. Shame on you.
We have been very aggressive. We are, as I said, looking at and analyzing what is happening here in Michigan, and we're always going to be aggressive and make the best decisions based on.
Well, why haven't you shut down the people first and asked them to stay home like your fellow governors did?
Continually trying to determine what we need to do to keep people safe and to keep our healthcare system from being overwhelmed.
You've said that you don't think the federal government did proper planning. How much of a difference do you think the recent measures, purchasing those N95?
Yes, let her attack, Martha. Ask her to attack.
I mean, it's important. We got to have those masks. I am working with companies to purchase masks as a state.
Well, why haven't you done it?
The federal government really started focusing when it became clear that the whole world was going to be confronting this. We would be in a stronger position right now, and that's an issue that I'm not going to belabor because I've got to keep solving problems, and I would like the federal government to be a partner. I can't afford to have a fight with the White House, but the fact of the matter is, at some point, we're going to have to analyze where all the failures were, and we're going to have to make decisions that
look in the mirror at yourself, ma'am.
Lives will be lost because we weren't prepared. Our economy will struggle longer because we didn't take this seriously as early enough as a country, and there are going to be consequences of that. But right now, I got to solve problems, and I need the federal government to help me make sure that I've got what we need for our frontline providers in particular, but also ventilators for people that are going to suffer.
What do you think the situation in Michigan will be 2 weeks from now?
It's, what, Martha, it was only 12 days ago that we had our first case, and now we have over 800, around 8 people have died. The numbers are growing so quickly, it's hard to say solidly what we know at this moment. And we've had an infant detected to be having COVID-19. So the thought that this is only one segment of our population that is exposed or in danger is ridiculous. We have to all take this seriously, and every one of us needs to do our part.
Including yourself.
COVID-19, and wash your hands. Practice social distancing. Stay at home if you're not absolutely needed to be outside of your home. And if you do go outside, keep that 6-foot distance from others. We all have to play our part to mitigate the spread and to save our healthcare system.
Good lessons for everyone. Governor Whitmer, thank you, and thank you to Governor Murphy as well. Up next, Dr. Jen Ashton joins with the latest on testing and treatment.
Consider America to be on a wartime footing in terms of fighting this virus?
I do. I actually do. I'm looking at it that way. I view it as in a sense, a wartime president. I mean, that's what we're fighting.
President Trump striking a more serious tone at one of his near daily briefings, which have sometimes sown confusion and doubt over the government's response effort to the crisis. Joining me to discuss that and more, ABC News chief medical correspondent Dr. Jennifer Ashton, former Trump Homeland Security advisor and ABC News contributor Tom Bossert, and former acting Homeland Security Secretary Kevin McAleenan. And Secretary McAleenan, I want to start with you. We have this massive flow of information. You and I were talking, and you said it looks almost like a military commander. You need a military commander to run this massive operation on what is essentially a battlefield. Do we have enough people? You heard the FEMA director. What do you see?
Right. Well, I had the opportunity to work closely with Pete Gaynor at FEMA and the team on Hurricane Dorian and many other incident responses. And now we have the operational muscle of FEMA backing the medical professionals at HHS. And I think that's a really important step. But this information flow is at a different scale than any crisis that I've seen. We got all 50 states engaged. We're trying to bring in data from hospitals, from medical professionals. We're trying to look at what's happening in 140 countries where this disease is present internationally. That's a huge amount of information to try to process, discern the key points, and then take appropriate actions.
And you heard me press him about warnings and about intel. How does that work? There had to be warnings. John
Sure.
Cohen, who was also one of our contributors, just texted me a short time ago and said there were warnings. They were ignored. We should have been more prepared.
Right. Look, epidemic response for the Department of Homeland Security and Health and Human Services that has the lead role is not a hypothetical. I mean, just in my 20 years at DHS, we dealt with things from Ebola in 2016 very significantly to Zika to H1N1, SARS, MERS. These were periodic. What's different about this is the infectiousness combined with the lethality. This is a completely different pathogen, and it's created challenges that are unique and different.
But wouldn't, if you have warnings about a pandemic, they would be unique and different, it would seem. And so why not prepare for something like that? Given the fact, obviously, it's enormous and it's global and it's a new virus, but is there not a way to be prepared for something like that?
I think there's a lot of preparation. There's a lot of equipment in the stockpile. But again, the scale of this is just very different. And what I see in this crisis right now is that we've reached a very important point. Two key points in any crisis. You have an action point and a turning point. I believe we hit that first point. Action means we have a clarity on the problem, we have a shared strategy, and you have the key elements of the national machinery mobilized toward that end.
Amen.
You've heard about this. The state and local governors are fully engaged. You've got the coronavirus task force. You've got the private sector now. 20 vaccines, according to the World Health Organization, already in testing. You've got antiviral treatments that on the therapeutic side might make an impact. That's what we want to see. Everybody moving in a complementary direction.
Amen.
And with a sense of unity.
Except the media.
Relationship, which has also emerged over the last week.
So when you look at the data that you've seen, and you know people at home are so nervous about this, what do you think we'll see? When do you think we'll know more about how long this might last?
So we're about halfway through the 15 days to flatten the curve period. I know the coronavirus task force, all the public health professionals, Columbia University, everybody's working on analyzing the models and seeing what we're going to be facing. I think a week from now we'll have a better picture. I think 4 weeks from now we'll have much more clarity on how long this is going to last, the extent of the outbreak in the United States, and what we're going to have to do in our daily lives to address it.
Thanks so much for joining us this morning. I really appreciate you.
Thank you.
Former acting DHS Secretary Kevin McAleenan. Let's bring in Dr. Jen Ashton and our own Tom Bossert now. And Dr. Ashton, you heard health experts in that press conference yesterday say that not everyone should be tested for the virus, prioritizing those who are already hospitalized. So are we in a new phase of this disease? Does it not even matter anymore that people are tested?
I think we absolutely are in a new phase, Martha. If you go back just a few weeks ago, there was such a big push and focus on getting more tests out there. And I think now it's almost looking like that was an unfortunate diversion because, yes, data does drive decisions. It's important to know the penetrance of this virus in our society. But right now, the focus on testing everyone is drawing our attention and valuable resources away from critical care, not just of patients with severe COVID-19, but with the patients that are already and always in our healthcare system at baseline, the heart attacks, the strokes, the accidents. So I think we are going to switch very rapidly, and we heard Dr. Fauci mention it yesterday, to this message. If you have mild symptoms, do not try to get a test, because as you see the focus on PPEs, we have to understand that our surge capacity here on a healthcare hospital level depends on staff, supplies, space, and systems. They are all interconnected. PPEs do not work by themselves unless there are healthcare workers to use them. So I think we need to rapidly shift to the more critical patients so that we don't have a situation as we're seeing unfold in Europe.
And Tom Wasser, you have been watching this for weeks and tracking the data. Is where we are today with the number of cases, number of deaths, where you expected us to be, better, worse? Because many healthcare experts are showing we are tracking with Italy, and that's obviously not good.
So, Martha, one of the problems with this is to treat the United States as a monolithic thing. We're a really big country, as you know, so much bigger than Italy. And so what Dr. Jen said is right in terms of testing. We needed more case ascertainment in the beginning, because the plan going into this was to target these clampdowns into places that needed to be clamped down. Because we didn't have that testing capacity, and because it came on us quickly, we ended up shutting down the entire country economically, but through social distancing, all at once. Now, where we look like we are today is that it seems to have worked. If people stick to this plan, I'm upset for those that don't stick to it, because we're all paying a very heavy cost here economically. And if you don't follow these rules, then you're slapping us all in the face, because we don't get the public benefits of that cost. So I would say there's a dichotomy, to answer your question, between the 47 states that seem to have a problem, but one that they can continue to control, and the 3 states led by New York, unfortunately, that seem to have a problem that is going to grow now in a way, and I say this and hope I'm wrong, that's going to overwhelm the New York healthcare system in the coming days.
And why not?
New York, California, and Illinois.
Shut down, slow down.
Well, what we don't want to do is fatigue the communities that don't have the need to act in this fashion, and or leave those communities that are in a really dire situation with the impression that they're not in that situation. So I'm not trying to be alarmist, but a clear-eyed assessment of where we are. Think of it this way. Administrator Gaynor said, I think he said, quote, every single governor is looking for the same thing. That is a problem. We need to focus our resources into New York and California, Washington State, the places right now that are seeing significant potential explosive growth.
And Illinois.
More than our hospital systems can bear. And Martha, think about this. If you're worried about keeping seeding coming from Europe at some stage, which I understand was a legitimate concern, think about seeding intra-state within the United States. And think, if you're a state that hasn't yet seen that seeding of this virus to levels that are that alarming, that you've got time to act, not that you've dodged a bullet.
And Dr. Jen, I want to go back to you. There's been new data this week showing a wider swath of the population is more susceptible, younger people, many more males with mortality rate, new symptoms, possibly stomach problems. Do these revelations mean the data is catching up, or we're simply learning more about the disease?
I think it's a combination, Martha. I mean, we do have to remember that we're less than 3 months just into the medical and scientific understanding and familiarity with this novel coronavirus. So everything you said really is important, new information that we've gleaned in the last couple of days. It's part of the reason why we need to track data and understand how this virus is behaving in the U.S. and what the patient characteristics and profiles look like. But I can tell you, Martha, to dovetail off what Tom just said, in New York City, the hospitals are already underwater. We've seen urgent pleas for anyone with a healthcare license, doctors, nurses, physicians' assistants, to identify yourself to a local hospital system. We have an evolving situation in obstetrics with multiple positive patients, mothers, infants, fathers, all being separated. There is literally brewing confusion and chaos on a clinical level here. And without the information you just mentioned, we can't integrate all of this. And we are, I think, going to rapidly see a strong message that if you have mild symptoms at any age, don't focus on getting tested right now because you're taking resources away from someone who literally may
Dr.
be
Jen, I've
in a
got to
more
wrap
critical
you there,
medical situation.
We so appreciate everything you said this morning. Tom Bossert and Dr. Jen Ashton, thanks very much. Rahm Emanuel and Chris Christie are standing by.
And here we have two, what I call political people for their own interest, attacking the administration. One liberal elite Democrat and another Republican who's sad and sour because he's not in the White House himself. Shamefully letting Martha direct their attacks on the president. Ridiculous. Absolutely ridiculous. This is what's wrong with the media today. They're not interested in helping. They're not interested in protecting the citizens. They're interested in promoting their issue, and that is their issue. They hate the fact that President Donald Trump and Mike Pence are president and vice president, and they're doing everything they can do to attack him for the upcoming election. Shamefully.
Here is what we're going to do en masse. Here's what we're going to do to stand up ICU units. Here's what we're going to do on.
They've done all of that, Rahm.
We're putting a floor under the economy to stabilize the financial market and then allow pieces.
You ought to go home and straighten up your town called Chicago.
To lead this country.
Mayor, I just want to drill down with Governor Christie on the stimulus package that we now have, the rescue plan on the Hill, probably more than $1 trillion. Governor, do you think that will do it? Will that sustain this country month after month after month?
First of all, I didn't think they filibustered in the House, but Rahm's doing a pretty good job this morning. But let's face it. Let's talk about the things that have been done already. There have been 2 bills passed already and signed by the president, and a third one in negotiation that is planned to be done by tomorrow evening. Now, will that be enough? We don't know yet, Martha, whether that will be enough. But we also know that we've now had, and there was announcements yesterday, and there will be more tomorrow, regarding the manufacture of an enormous number of ventilators that are being done in coordination with the private sector. Folks like General Motors and others converting their plants to now, putting ventilators into production rather than automobiles. So this is what we're going to do for the country. Part of the way to unite people, part of the way to bring them together, is to be laying out the facts and then setting clear goals for what we do next.
And that's what President Trump has done all through the whole thing, including in the beginning of shutting down the borders.
And making sure gasoline was widely available, not only for automobiles, but for generators to keep people going who haven't gotten their power back yet. The president is now beginning to lay out those things about what we need to be doing going forward, and has led with the governors. As a governor, I want to tell you, I'm glad that the governors are as involved as they are. I'm glad Governor Cuomo, Governor Hogan are as front and center as they are, Governor Newsom in California. These are important leaders who know how things are going on the ground. And so the White House has to work with them. And FEMA being involved now is a great help as well. That's only a result of the president declaring a national emergency.
Easy decision to make. I applaud the big 3 working with the UAW for making that decision. But at the end of the day, we've got to make sure that we can still be competitive, that we can still be on the cutting edge of mobility and solving the problems that we're confronting as a globe. And so the auto industry has to be right up there with any other industry that is able to access loans and to get some assistance during these times.
As we mentioned, General Motors has offered to retool to make ventilators, which may help to increase the supply. Are you experiencing shortages in your state?
We are. We anticipate an incredible need for ventilators, just as every other state's anticipating. We're actively trying to find ventilators or bring ventilators back online that perhaps were retired. So the fact that GM is really serious about moving into that space right now, this is a global crisis. This is an automaker that helped make us the arsenal of democracy when we were in the war. This is something that we have a battle on our hands, and it's got to be all hands on deck. So we're grateful for their leadership.
You know, both sides here are calling for politics to be left out of this as we respond to it. But the president was very critical of you the other day, tweeting, quote, "Failing Michigan governor must work harder and must be much more proactive. We're pushing her to get the job done. I stand with Michigan." What aren't you doing, Governor, that you could be doing more of? I know that Republicans in your state have said maybe extend unemployment insurance to people who are working part-time, unemployment insurance to contract workers, allow Canadian doctors to practice in the United States, allow online work by students to count, suspend fees for hunting and fishing licenses.
She's busy attacking the president. That's what she's been doing.
Bars and restaurants to sell takeout liquor. What are you?
Unfortunately.
Is there more that you could be doing? What are you considering doing?
Well, I think the irony of the attack on Twitter is that we've actually been a lot more aggressive than the federal government. We've been taking this very seriously.
Nonsense.
He's responding to my criticism that they didn't do the preparation that they needed to do on the front end. That's why we have a shortage of tests. That's why we have people who don't take this seriously.
You're the governor of the state of Michigan. You're supposed to be in charge.
This is what we're up against. We have to have truth in
Look in the mirror.
communication. We have to be making decisions based on science and facts. We can't have half-truths or hyperbole convince people that this isn't to be taken seriously. If you're not serious, you're woefully uneducated about what we are confronting as a nation, and that's why I'm trying to implore everyone to take this seriously. Do your part. Every one of us, whether you're asymptomatic and healthy today...
Look in the mirror at yourself. You haven't even shut down your state yet.
Washing your hands, social distancing, all of the practices from the CDC. I've been so impressed with Dr. Fauci, but everyone needs to really listen to him.
That said, Governor, are there other steps that you could be taking that you're not taking right now?
So, we've been aggressive. I was one of the first governors to call off school for a period of time. I was one of the first to close down a lot of restaurants.
What about these other items, though, like extending unemployment insurance benefits, bringing in Canadian doctors, hunting and fishing license suspension fees?
I single-handedly extended unemployment benefits in one of my emergency orders from 20 weeks to 26 so we can help people who are unemployed. I called on the White House to make sure that we had an exemption on the travel ban between the United States and Canada for frontline medical workers.
But what about going forward? What else are you thinking about?
We're obviously sharing as much information with my fellow governors so that we're making smart decisions moving forward. There are additional steps that we are going to continue to take, and we'll be rolling those out today, tomorrow, throughout the week.
What are they, is what he asked you.
Precisely where we can make a difference and how we can take additional steps to flatten the curve. We've been aggressive in Michigan. We're going to continue to be.
Governor Whitmer, we certainly wish you all the luck in the world as you fight this challenge. Thanks so much for joining us this morning. Really appreciate you taking the time.
Thanks for putting her on the spot there.
Up next, we'll bring in our Sunday group to discuss the impact of coronavirus on the nation.
A broad U.S. outbreak.
I think it's going to work out fine. We're going very substantially down, not up. One day it's like a miracle. It will disappear.
Even as he was getting intelligence briefings in January and February about the global dangers posed by the virus. Even now, misstatements and mixed messaging are adding to the confusion. On Friday, the president touted
Fake news, totally.
drug for the coronavirus.
Pieced the way together they want to piece it together with a bunch of lies from Meet the Press and Chuck.
Control the clinical trial, so you really can't make any definitive statement about it.
And Mr. Trump lashed out at reporters.
What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter.
And I'd say he's a jerk.
As the economy stalls, Goldman Sachs predicts unemployment claims will spike to more than 2 million this week. And lawmakers are negotiating plans for $1 trillion economic relief package, which would include small business loans, corporate bailouts, and direct payments to millions of Americans. And joining me now is the chair of the National Governors Association. It's Governor Larry Hogan of Maryland, and the mayor of New York City, Bill de Blasio. Gentlemen, welcome back to Meet the Press. Mr. Mayor, I want to start with
two people that dislike Trump, including this guy in the center, Chuck, who hates him with a passion.
Noted on Friday the grim reminder that New York City, I think, now has a third of all cases in this country. What can you tell us this morning? Is there any ebbing of this yet?
Chuck, the truth is, and New Yorkers and all Americans deserve the blunt truth, it's only getting worse. And in fact, April and May are going to be a lot worse. Right now, we are a third of the cases in the country. That's going to get worse. We're about 2/3 or more of the cases in New York State. That's going to get worse. But Chuck, the President of the United States is from New York City, and he will not lift a finger to help his hometown. And I don't get it. I don't get it. Right
Nonsense.
now, I've asked repeatedly for the military to be mobilized, for the Defense Production Act to be used to its fullest, to get us things like ventilators, so people who can live who would die otherwise. Chuck, I can't be blunt enough. If the president doesn't act, people will die who
This is nothing but a political attack by a guy that ran for president.
Get action from the president of the United States.
What is it that you want the military to do immediately? What would there be a specific thing you'd want the military to do immediately?
Chuck, the military has extraordinary medical capacity of its own that's been honed in fighting wars. They can handle any situation. All military personnel who are medically trained should be sent to places where this crisis is deep, like New York. Right now, the military is the best logistical organization in the nation. If there are ventilators being produced anywhere in the country, we need to get them to New York, not weeks from now or months from now, in the next 10 days. And the only force in America that can do that is the military. Why are they at their bases? Why are they not being allowed to serve? I guarantee you they're ready to serve, but the president has to give the order.
The shelter-in-place order for New York City, how do you plan on enforcing this next week?
Chuck, people really do get it. I've been around my city the last few days. They're getting the message more and more. Also, we will use the NYPD and other agencies to go out and remind people, educate them, break up groups of people if they're congregating. It'll take a while for people to truly get it. Yeah. But right now, I'll tell you one thing. Everyday New Yorkers, everyday Americans are much farther ahead of the curve in terms of understanding this crisis than anything we're seeing from the White House. And that's troubling to think that people have
Nonsense.
Are not using it when everyday people get right now. Shelter in place is necessary to protect our families.
Governor Hogan, I want to talk to you. You and I believe, and Governor Cuomo of New York jointly wrote a letter to the president. I think number one, you wanted to get FEMA in the lead role. They're now in the lead role. But let me ask you on this issue of procurement. We already know Governor Cuomo basically admitted he had to get price gouged in order to buy some N95 masks. Who should be the lead agency here? Should FEMA be the one both purchasing and doling this out, or should the states be competing against each other?
Well, look, so this is a problem that everybody's been talking about for a week, but I don't think just talking about what was done wrong yesterday or last week or last year is really that helpful in the discussion. Governor Cuomo is the vice chairman of the National Governors Association. I'm the chairman. I can tell you that we've been talking with and meeting with all the governors, with the vice president, occasionally with the president, with all the senior team almost every single day, talking about the need. And I believe we've pushed for action, and we are getting some progress. Now, it's not nearly enough. It's not fast enough. We're way behind the curve. But let's talk about, we're trying to figure out what we can do to move forward. And they are making progress. It's not fast enough. But on all of those things, on respirators, on PPEs, on the masks, on the test, we're ramping up. New York has about half of the aid of the rest of the country. They're focusing on the 3 states that have the worst problem right now, and New York is one of them. But they're really trying to push things out to all the states. But yet, of course, it's not enough. And failures were made, and things that should have happened sooner. But
by the governors themselves.
Because our job is to save the citizens. We had another death here in Maryland last night. We just hit over 500 in the Washington region, and instead of just talking about what didn't get done, I just want to get things done.
I understand that. That's why I want to ask you: do you feel as if there is a point person in the federal government that is handling the N95 mask issue, or do you feel as if you still have to find different ways to acquire masks?
I think it's a little bit of both, Chuck. So FEMA, we pushed to get FEMA in charge. I think they are listening to the governors. All 55 governors have stepped up and weighed in. We listed priorities about what had to get done, what they needed to focus on. They're responding to almost all 5 of those requests. But FEMA has to take the lead. But we also have to we can't wait. So we're taking individual actions as well. It's not a perfect situation, but we're trying to ramp up and order things on the open market, get some things produced here. It's going to take the federal, state, and local governments all stepping up and doing whatever it takes, regardless of who's supposed to do what. We've all got to jump in and do whatever we can.
I want to talk about
just where we are.
I want to talk about a regional issue. I'm going to show some pictures to our audience. You can't see this, but this was at the Tidal Basin yesterday in Washington, D.C. Not a lot of social distancing was being practiced there. You've been concerned. I know that Virginia hasn't issued the same level of restrictions that Maryland and D.C. have had. The inability to operate as a region here, is that a problem for you? Are you hoping that the governor of Virginia in particular and the mayor of D.C., that all three of you are going to be on the same page here?
Well, so in addition to meeting with all the governors, we've been meeting as a region with the governor of Virginia, with the mayor of D.C. We talked on Friday. We're going to be talking again, I believe, tomorrow. We're all taking actions and trying to work together. But yeah, the social distancing is not being enforced, and it's a little crazy to see the kind of crowds at the cherry blossoms. I mean, people have to listen. There's people that are out there. I mean, you are endangering not only yourselves but your fellow citizens by not listening to these warnings. We've been getting pretty tough out here in Maryland on folks, limiting people to groups of 10. We were chastising all these spring breakers that came back from partying in Florida, and we told them they need to self-quarantine for 14 days. Otherwise, they're risking their lives of their parents and their grandparents and their friends, because this no longer is just about older people of all ages. 40-some% of our cases are under 54 years old, and from 18 to 54. We had a 10-month-old, a 5-year-old who have gotten this disease. So the people are kidding themselves.
Well, start using the media to help instead of attack. Would be a big change.
Business is normal. We've got to get people off the streets.
Stop trying to make it political.
It's absolutely essential.
Mayor de Blasio, there's a lot of people who are going to wonder, what does progress look like? And because it's an invisible enemy, and every day the numbers right now are getting worse, not better, how can just people who are sitting at home anxious to know when do they get to go back to work, what does progress look like to you?
Chuck, first of all, I respect Governor Hogan for sure, but I just disagree with something he said. It's not about blaming people for what happened in the past. It's about right this minute. The American government is not at full bore right now. The Defense Production Act, it's been activated. We've gotten no indication of any factory on 24/7 shifts. We've gotten no shipments, and the U.S. military is at its bases instead of at...
Well, where is your police department? Where is your National Guard in the state? Goodness gracious sakes alive. The Army is for defense.
The federal government needs to be in this fight instead of on the sidelines. I'm not worried about blame. I'm worried about saving lives right this minute, and I don't see the federal government at this moment. To the point at hand, Chuck, April is going to be worse than March, and I fear May will be worse than April. So, bluntly, it's going to get worse, a lot worse, before it gets better. But what would be progress? Real, consistent social distancing being enforced, people living with it, and hospitals that can function. People seeing that their healthcare system is actually holding because we have the supplies and the personnel. And I think that's going to be a national reality, Chuck. Medical personnel are going to have to be taken from one part of the country to another as this crisis deepens.
Well, quit blaming the president and take charge yourself. You're the mayor of the largest city in the country.
If it starts to collapse, think about that in the United States of America in the 21st century, if our hospitals can't function because our government wasn't there for them.
Governor Hogan, what would you give as a prescription of what does progress look like as we sit at home and wait?
Well, look, nobody knows where the end of this is or when the spikes are going to happen, but progress is going to be if we can somehow bend this curve downward and we can start to stop that spike that's going so we don't overload the healthcare system, and if people are just going to, look, it's very disconcerting. People's lives are disrupted. It's scary, and I understand people out there concerned about when is it going to look better. Just know that people all over the place are working as hard as they possibly can to fight this hidden enemy. And it's going to take all of us, not only the local governments, the cities like the mayor and the state governments, all the governors, the federal government, but it takes every one of our citizens as a part of this, and we can't stop it without them cooperating. But it's
that I agree with.
How long or how bad it's going to be.
Lead by example.
Continue until we can get it stopped, and we're just going to keep.
And that includes you, Chuck, on Meet the Press.
It's not true that people everywhere are fighting with all they got because our military is being sidelined and the White House is in denial. It's just not true, Governor.
Well,
I
I'm gonna
respect you, but that's just not true.
Well, we've got military all over our state doing all kinds of great things, like
You've got National
humanitarian
Guard. You do
missions,
not
standing up
have the
food,
American
helping
military.
with hospitals,
Okay,
and building new hospital beds. And your governor in New York is doing the same thing, so maybe you ought to try to talk with them and see.
I
if you
have
can-
talked to him. It is not that not everyone's doing everything they could do.
and I think
Governor.
we're all-
Let's be honest about it.
and I'm going to be speaking with the FEMA administrator in a few minutes as well. Governor Hogan, Mayor de Blasio, I know you guys are both fighting the same fight here. At the end of the day, let's get rid of this virus and let's hope we can get back on track here. Thank you both. I know it's trying times for both of you, so thank you for your service. The coronavirus crisis has sickened the American economy, with businesses shuttering, unemployment spiking, and the Dow losing all the ground that's been gained under President Trump. Democratic and Republican Senate negotiators are back at work today. They're trying to agree on a rescue package that is expected to be well in excess of $1 trillion. It could even get close to $2 trillion. Among the negotiators in the room is my next guest here. It's Republican Senator Pat Toomey of Pennsylvania, and he joins me now. Senator Toomey, welcome back to Meet the Press. I know there's going to be a meeting. Good morning. I know there's going to be a meeting between the 4 leaders in Congress in about in the next couple of hours that tells me that maybe we're landing the plane here on phase 3. What is the latest, and how quickly do you expect a deal?
Chuck, I think you're right. I think we're on short final, and we'll have this plane landed. It starts today with a very, very important procedural vote this afternoon, which will really tell us if we're going to be able to go forward. I think we will. And I'd like to just share with you a quick summary of what's in the bill. And I think you'll see why it would be it'd be very hard, I think, to vote against this. So I think of it in several categories, 3 categories, really. The first, we're focused on, take the guy who wakes up tomorrow morning in Pennsylvania and can't go to work. He's got a family to take care of, and Pennsylvania's closed down all businesses.
Right.
So that describes, of course, millions of people across the country. So focusing on individuals and families, we have already created a new paid family leave program, a paid medical leave program. We're going to plus up unemployment benefits significantly. We're expanding eligibility for unemployment, and we're sending direct checks to all middle and low-income workers, substantial amounts of money. So that's focused directly on getting people through this period.
Right.
The next category is the resources we're sending directly to healthcare providers, hospitals, expanding our ability to research, develop, bring to market therapies, vaccines, all of the things that we need to be doing in that space. And then the final space is, it's essential that people have a job to go back to when we get through this as soon as we possibly can. And so there's a very, very large small business lending program that is in this legislation, and those loans, Chuck, are meant to be forgiven to the extent that they are spent on maintaining payroll. And then there's a very, very large credit facility that we're standing up. It'll be done jointly with the Treasury and the Fed, and it'll make sure that our financial markets function, and most importantly, that businesses can get temporary credit. So this is going to be a very, very large, very powerful combination.
All right, let me ask about some specifics that I know most viewers are probably most anxious to hear, and that's the direct payment situation. Number one, is it going to be sustained if the national emergency goes into May? We know there's an April payment that is planned on. Would there be a May payment if we're still in a national emergency, and is that codified in this bill?
So that is not codified in this bill, but let's keep in mind, first of all, we are going to make a tremendous amount of resources available to companies to keep their workforce employed, because we're hoping this is a relatively brief period, and we want those folks to still be associated with their company, so they're called back to work rather than feel like they've lost that tie. That's number one. Number two, there's very generous, significant unemployment benefits. So we'll reevaluate.
Okay.
If we are, several weeks from now and we think we need another round, it's not the most efficient way to do this, by the way, Chuck. We're sending checks out to a lot of people who will still be salaried people who still have their income, but it was seen as the fastest way to get money in people's hands.
Right. 3 things. Do you believe that the public role, the